Good afternoon, Stuart Finlay. I'm a GP, Chief Clinical Officer for my CCG, and I'm currently chair of our existing operational urgent and emergency care network across the North East. So this afternoon we're presenting a proposal for the whole of the North East of England. Our proposal covers a population of 2.7 million, 10 CCGs, 400 general practices, 7 acute foundation trusts, 2 mental health foundation trusts, but we're fortunate in that we have a single ambulance trust hosting a single 111 provider. All of our CCGs are supported by a single commissioning support unit. Every single organisation, plus our local authorities and our voluntary sector, have supported this bid, and individuals within the North East have given up their right to submit a Vanguard bid in favour of this One North East bid. We have a long history of working closely together across the North East, and we have very strong existing managerial and clinical networks in place. Examples of the benefits of this coordination include a regional approach to value-based commissioning and a regional approach to our divert policy. However, we have major issues to resolve in the North East if we're going to improve the health and well-being of our population. We have some of the most rural areas in England. We have some of the most deprived areas in England. We have the highest levels of unemployment in England, and we have the lowest household incomes across England. We also have an unhealthy dependence on hospital beds, with non-elective admissions being 36% higher than the England average. We are making improvements, however, to our services, but our urgent and emergency care network will accelerate and industrialise those changes. Only then will we be able to deliver consistent, high-quality, safe 7-day services provided wherever possible near to our local communities. I'll pass you on to Jonathan Richards now, Jonathan Richardson, who will talk about joint working and outcomes.
Thank you. I'm a doctor, I'm a consultant old age psychiatrist. I'm also a deputy medical director in one of the mental health and learning disability providers in the region, but I'm also a dad. So this is vitally important to me, not only as a professional, but also as a patient and a parent. We are ambitious to improve outcomes for the patients, population, professionals and providers whom we serve. We will deliver our vision by providing a network of urgent and responsive services which can go to where the patient need is in a seamless way. We have already implemented an urgent and emergency care model within mental health, enabled by an electronic patient record, digital dictation and mobile working, with measurable outcomes. We have an access team that works alongside 111. We have street triage, which has shown a reduction of 60% in the use of the Mental Health Act. We have crisis teams, which include those for children and younger people. We have liaison teams. We have developed on the RAID model that our colleagues talked about previously, and we have seen a model that has resulted in 90% of patients being seen within 60 minutes within the emergency department, and also have implemented 7-day working for some of our consultant psychiatrists. We have a track record of collaborative working. For patients, we have public engagement and evaluation of our winter campaign. Professionally, we have strong strategic clinical networks and one of the only functioning clinical health informatics networks in the country, and also centres of excellence for research such as the Camps for Ageing and Vitality. For providers, the previous SHA adopted the North East Transformational System, which utilised lean methodology to improve outcomes. We aim to provide and improve value for the patients, decreasing face-to-face contact by the use of, say, telehealth in our children and younger people's services. We aim to prevent avoidable admissions, building on the 3 Vanguard sites that we already have. For example, the development of a dementia and delirium team for geriatricians and old age psychiatrists. We would like the spotlight and the challenge of the Vanguard so that we can learn and share for the benefit of the patients that we serve. I'll pass over to Yvonne, who will talk about the successes.
Hello there, my name is Yvonne Ormston. I'm Chief Executive of North East Ambulance Service, previously worked in acute care, leading on redesign of emergency care. I just want to share a couple of extra examples to what Jonathan's already shared with you. We were the first implementer of 111 and we continue to develop on this regional service supported by the Directory of Service focused on self-care, hear and treat and alternative pathway disposition. We have lots of examples across the region on digital and new technology solutions. We're developing our clinical hub. We're working closely with our mental health colleagues on community alternatives to admissions. Our SRGs are working at pace and scale around developing primary care capacity. We have integration of 111 with our 3 GP out-of-hours providers, including one of them who supports us in the delivery of 111. We have very strong regional clinical networks, whether that be trauma, cancer, cardiac care and so on. Our first new specialist emergency care hospital opened last month in Northumberland, providing 24-hour consultant cover, and we are reconfiguring acute care across the region in terms of pathways and future provider portfolios. We're very proud of our flight desk initiative that we developed last winter to help us oversee system capacity on a 6-hourly basis. The Ambulance Trust took the lead in determining intervention and support to acute providers. I'm now going to pass to Mark, who's going to tell you how we want to build upon that.
My name is Mark Adams and I'm Chief Officer of the Newcastle and Gateshead CCG. I just want to talk very briefly about delivery. Delivery is vitally important for us. We spend a lot of time and effort getting all the organisations across the North East network to sign up to this work and sign up collectively. As we've already said, we have a great tradition of collaborative working across the North East, and we're now mobilising this to turn our attention to this agenda on an industrial scale. In terms of delivery, there are some specific areas that we're very interested in early on. That's specifically in terms of the self-care and the prevention agenda, not least in terms of things like being able to flex and develop professional roles, such as pharmacists, which colleagues have talked about earlier today, but also in terms of how we implement online support and mobile-based support to help us in those kinds of areas. We're also very focused on how we get 24/7 senior level clinical decision making much earlier in all of our pathways across all of our systems, and that's very important for us. But in amongst all those things that we want to do about professional development, pathway development, etc., we are also very, very focused on enabling. And key areas for us are in terms of financial and models of finance and pricing to support the implementation and development of these services, but also how we use things like our network-wide BI system to be able to quantify not only what we do now, but also to be able to help us identify early on the things that work and how they are working for us to help share with everybody else. Thank you.
Thank you very much. Just to clarify that this is the North East Urgent Care Network and not the presentation. We'll correct the presentation just so you're aware. And they're North East, I believe, North East England in your pack.